Let me mention to you some of the genes that are actually involved in this type of cancer. I don't want you to cram these genes. Don't even try to cram these genes. So these are the genes. And you remember, we mentioned 3 things when we were talking about the basics of cancer. We mentioned the proto-oncogenes being converted to oncogenes to cause cancer. We mentioned the tumor suppressor genes that actually suppress the multiplication and growth of cancer. We mentioned the DNA repair genes that actually come in to repair the mutations. You remember that? I hope you do, because these 3 are the basics of cancer. So when you have proto-oncogenes, you will not have cancer. But when you activate them and they overreact to form the oncogenes, you now have cancer. So the more the oncogenes, the more the cancer. The less the tumor suppressor genes, the higher the cancer. The less the DNA repair genes, the higher the cancer cases. Now, the oncogenes that are responsible for lung cancers. Number 1 is KRA. KRA, yeah? Kenyans with KRA. KRA is part of it. Number 2 is BCL2. So when you see lab tests that are actually indicating either KRA or BCL or HER, which is HER2, you simply know they are trying to actually diagnose me of lung cancer. So now I'm helping you to interpret those tests. So HER2, BCL2 and KRA. Hapo kwa KRA ndo tuko pamoja, si ndio? And then for the tumor suppressor genes, if you have less of them, the tumor suppressor genes that are actually responsible to help you suppress this. So when you have less of them, you'll suffer. PS3, RB1 and P16. Now, I don't want to even cram these genes because I'm just showing you that there's a genetic link, but it's very minimal because these genetic links is actually the ones that actually are activated by the diets and lifestyles. So how can you expect to consume titanium dioxide? How can you expect to consume wheat, sugars and all that and then expect not to have these genes activated? You will have it. You go to diagnosis. You get all these types of diagnosis. You start with the chest x-ray, you go for, they see a nodule, they refer you to a CT scan or an MRI. You're going to have a low-dose CT scan. You get now these images that are actually crazy. You're afforded to a PET scan, and the PET scan shows, oh, there's a problem here. And then now they recommend biopsies. All those tests, you're actually spending a lot of money. And then the biopsy comes in, and before they even do a biopsy, they send you for the PET scan or even the CT. And then because there's a nodule in your lungs, they decide, you know what, this must be, we must question cancer here. As you screen yourself every year, because when you have a PACI of above 30 or you have exposure to these risk factors, you need to screen yourself basically every year. Imagine that. It's hectic, right? But this is the point. You need to screen yourself basically every year. But always be careful, and this goes to the doctors also, be careful of the false positives. Be careful of the false positives because these results are, they kill people. Do you know the burden that will come to somebody who has just been diagnosed of cancer? Do you know how you will drain this person financially, emotionally, physically? Do you know how these people will lose weight from just getting the diagnosis alone? It's the same thing when you get a HIV scare. You lose weight so fast. So take appropriate medical history, take appropriate medicine history, examine the patient totally so that you rule out any other conditions. Go deeper into their family history and see all these things. And then now you can jump into the lab tests. You can do a full hemogram or a complete blood count. You can do a liver function tests because you see, most of these conditions, most of these lung cancers are secondary to liver cancer, to colorectal cancer, and to breast cancer. So rule out high estrogen in the system if it's a woman. Rule out colorectal cancer if it's a man. Have they been on medicines to control gastritis all the time? Have they used the H. pylori kits multiple times? Have they been on TB treatment? Have they treated pneumonia all the time? Go deeper into this. You will find your solutions there. Send them for a CBC, a complete blood count, to see if they have low blood levels, to see if their parameters are in order. Send them for LFT to see if their alkaline phosphate levels are okay and their liver function enzymes are okay. And then send them for a sputum cytology to just ascertain that this is not TB, this is not pneumonia, this is something else. Send them for a CT now. A CT, and if you're doing a CT scan or any scan, make sure it's the chest, make sure it's the colon, make sure it's the pelvic, and make sure it's an abdominal CT. Why? Because for abdominal, we are looking at the liver cancer. For the pelvic, we are looking at the colon. For the chest, we are looking at the lungs. So all these are combined because we cannot rule out the occurrence of other cancers and focus on lung cancers alone. We must make sure that we are doing all this to make sure that we are ruling out the occurrence of these types of cancers which would have metastasized into the lungs. You see that? So you become so detailed. You'd rather take one day on one patient, but make sure you've done justice. And then after that, now you can send them from radiologies and all that. So you basically start with the examination and then lab tests and then now radiology. Because the examination and the lab tests will forward you into the radiologies and the CT scan and the PET scan. So now you go for tissue biopsy, and when it comes out, now we can actually advise. But you see, for the lung cancer, at stage 1, at stage 2, at stage 3, you can simply do chemo. So stage 1, stage 2, stage 3, chemo, radiation, possibly a surgery. But we've said the prognosis is very poor. Okay, so when you're diagnosed with this, of course, it's not the end of the world. There's something you can do to actually make sure that you prolong your lifespan. But the prognosis is always very poor. And now when you introduce the chemo, the radiation that are actually going to give you more side effects of the same thing that you're actually suffering from, that becomes questionable. So stage 1, stage 2, stage 3, all of them, surgery, chemo, radiation. That's how bad it is. And then stage 4, which is just palliative care. There's nothing you can do when it's getting to stage 4. At this moment in time, it has spread to different organs. It is in the liver, it's in the heart, it's in the lungs, it is in the brain, it's in the colon. It's literally everywhere. So there's nothing you can do about it. And because it spreads so fast, the earlier you get the diagnosis, the better. But the earlier you start prevention, the better. Don't wait for the diagnosis. The earlier you start the prevention, the better you are as a person. So if you want to prevent this, simply go back to the place where we talked about the risk factors and avoid those. Just drop them. Don't be lied to that if you're smoking cigarettes, you are at danger. But if you change the cigarettes to vape or to shisha or to nicotine patches, you are safe. You're not. And I want to tell you this for free. All cancers are the same. The only difference is how they spread and where they spread to. Like if somebody understands colorectal cancer, they will know this one has a high chance to spread to the lungs. Therefore, lung cancer comes secondary to colorectal cancer. If you understand leukemias, you'll simply know that leukemias can actually spread to different organs through the blood. Therefore, these are secondary to the blood cancer. So all cancers are the same. The only difference is the truth where they spread through and the organs that they affect.